car seat safety education. Car seat safety education is a genuine issue, and proper education on this issue is very low. Although all 50 states require infants and children to be properly secured in all vehicles, the success rate of this being implemented by parents is more challenging than it appears on the surface. Unfortunately, many parents do not restrain their children properly in car seats. The result of this behavior is that children continue to be killed or seriously injured. Most parents are unaware that they are misusing car seats or improperly restraining their child because installing the car seat seems very simple. A process that seems simple but has very serious implications if not done properly. Implications that can last a lifetime. Schwartz and colleagues conducted an intervention program that found that when properly installed, car seats can reduce infant fatality by 71% and toddler fatality by 54%. However, 85% of children in the United States are still improperly restrained or car seats misused. They also showed a study that found that video-based education programs are more engaging, which are likely to translate into greater knowledge retention, changes in the parents' attitude, and parents' intention to use the recommended injury prevention techniques. A study conducted by Lee showed that most parents, about 60%, stated that their car seat education was something they learned in the home, in a friend's home, or in a relative's home. This miseducation is why car seat intervention programs are needed to re-educate parents with the proper techniques and methods for car seat safety. Car seat safety programs is one of the initiatives of the Onslow County Health Department to ensure that parents that need a car seat for their newborn child or children receives one. It was determined that there was a need for parents within the OVCM and the CC4C programs that did not have car seats for their children. This was an issue because parents could not take their children home from the hospital without the proper car seat. Therefore, the program provided a much needed service for the clientele of the Onslow County Health Department, especially those that are engaged in the OVCM and CC4C program, because these two programs deal with or engage children from birth to age 5. The structure of the intervention will be conducted with a 30 to 40 minute one-time one-on-one session with each parent or client. The model of the intervention will be best described as an education model because the mothers in this program receive education via discussion with the care manager and an educational training video. In a study conducted by TASER, the hands-on education intervention made a significant difference in the proper use of child passenger restraints by parents. Education increases the knowledge, and through knowledge, a change in the thinking of new mothers will affect their actions when putting a child in the car seat. Personnel for this intervention are social workers, registered nurses, and intern social work students. Improving the knowledge, which is the goal and objectives of this program, of the new and expecting mothers as well as other parents, will ensure that they have a clear understanding of how to properly place a child in the car seat. The long-term goal of this program is to reduce the death or seriously injured rate of child fatalities due to motor vehicle accidents. Child restraints, when properly used, as stated before, reduced car seat fatalities for infants by 71 and toddlers by 54. The target behavior of this research is to improve the knowledge of parents and of new parents and newborn children, parents of newborn children, while impacting and reducing infant death caused by improper car seat. Therefore, my measurement outcome is the parent's knowledge on car seat safety and the proper use of car seats. It is expected that with the intervention of this education on car seat safety, the parents will begin to immediately apply this newly acquired information and knowledge to their daily use of car seats with their child or children and share this information with their families. Methodology. My sample for this research comes from expecting mothers who are enrolled in the pregnancy care management program and mothers who have recently given birth that are enrolled in the Care Coordination for Children's program. Both programs are within the Untitled County Health Department, which is a part of the Consolidated Human Services Agency. The data will be collected at the Untitled County Health Department within the Care Coordination for Children's program behind the closed doors of the care manager's office. To maintain confidentiality, no names will be provided on either the pre-test or post-test. The results of each client's pre-test, post-test will be maintained in the supervisor's office, and a copy will be maintained in the administrator's office. Measurement tool will be a test that is created from the training video that all clients are required to watch. The test will be used for both pre-test and post-test. Scores will be compared afterwards and discussion taking place to see what was learned. There was no previous tool for this type of intervention by the agency or the producers of the video. The scoring of this pre-test, post-test is a point system. There's 10 multiple choice questions. Each question is 10 points. The lowest score can be gained as 0, with the highest score being 100 points. The analysis, the data was analyzed using a paired t-test, one group pre-post interval, which resulted in a p-value of 0.0031, implying that the results are less likely to have been caused by chance, but rather from the intervention. The data agreed with the hypothesis in that there was a significant increase in car seat knowledge after the intervention of discussion with the care manager and viewing of the video, thus showing that 0.846% of the tested sample showed improvement due to the intervention process. Compare t-test, one group pre-test, post-test method. Out of the 15 sample clients or parents, 13 had at least 10-point gain from their pre-test score, with one having no gain and one having a minus 10-point loss, with the standard deviation gain of 19.13 points. The lowest gain was 10 points and the highest was 60 points. The mean gain was 29.3 points. The mean of the pre-test score was 52.66, while the mean of the post-test was 76. Therefore, with a p-value of 0.0031, there is minimal chance that the results of the intervention happen other than because of the discussion and video. The limitations of this program or intervention. One of the limitations is that there is not enough visibility about the education program, meaning that we're not reaching a broad spectrum, that not enough people know about this program. So we need to get it out there to more people. Also, we're not reaching the large enough numbers. Our numbers are small. As you can see, we did 15 and this was done over a few months. However, there are more parents out there that need to get this type of intervention, so we need to increase our numbers. Okay, how can the agency use this positive results? More funding. The agency that I intern at can take these results, okay, with an average almost about 30% gain of the sample study that took the test and gained almost 30% better. They can use these results to show the justification to the county government and the Consolidated Human Services to further continue using funding to purchase car seats for this program. They can also use this data to show to outside agencies that supply money or funding to the Onslow County Health Department to continue to supply those fundings to purchase car seats, because the data shows that the program is working and education is being learned and acquired by the parents. What are other design strategies that could be used? Car seat certification training could be taught to the staff that certifies certain individuals within the agency to give hands-on training to the parents to be able to practice installing and using car seats properly. This will help enforce the education that they receive during the training video, thus enforcing what they've learned. Also, they can collaborate with agencies that they're already partnering with and get them to tell their parents about the car seat initiative and get them educated on proper car seat education, and thus broadening the spectrum on the number of parents that are learning about this initiative and intervention of car seat safety. Thank you.